Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
Boom! What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to welcome you to episode 63 of the Ask Dr. Angela podcast. So I am fresh off of a weekend on call. I hate weekend call. Let me just tell you, it's just, even if nothing's going on, you can't sleep, you're basically sitting on pins and needles waiting for something to happen. Anyway, this weekend was particularly quiet for me, which is a nice change of pace for me because I'm usually getting slammed. But I gotta share this with you. One of my biggest peeves when I'm on call is when you get these random phone calls, and they're not really random. You know, there are people that have questions, concerns, whatever. But you get these phone calls, and then you give your best medical advice, and the person on the other end doesn't want to follow the instruction. It's like, okay, well, why did you call me? If you don't want to listen to what I have to say or take my recommendations, then don't call me. So anyway, now that I've gotten that completely off of my chest, let's jump right into today's question or topic, which is, postpartum birth control options. I must review this at least 5 times a day when I'm in the office. I see at least 5 postpartum women a day. And, when you come to see me for your 6-week visit, birth control and all of the options that are available to you are one of the things that inevitably comes up. And one of the things, specifically in my multiparous patients, and by multiparous I mean, this isn't your first, second, and sometimes third baby, but folks that have, well-established families, one of the options that very rarely seems to be put on the table is having your man, husband, significant other, whatever, get a vasectomy. It's like, really? And a lot of times my patients will come in, they're like, well, my husband's entertaining the thought of getting a vasectomy. And I'm like, stop entertaining and just do it. Especially after my moms and my patients have undergone pregnancies, 1, 2, 3, maybe 4 and 5 times. And all you have to do, i.e. husbands, is go to the doctor's office and have an in-office procedure most times. Please. You better get with the program. I would love, and I know that we have a lot of listeners that happen to be male, but I want to know, what's the hesitancy in getting your boys clipped? It's so much easier than having to have women, once again, go to the hospital. In some cases, depending on the type of contraception that you decide to get, if you decide to get a tubal, depending on the type of tubal, that may involve general anesthesia. And then, all this stuff, with the E-Shore and having to have something else inserted into your body. And no offense to E-Shore, but, with all of the recent stuff going on with the FDA, I'm kind of just taking a watch and see approach. But I would love to hear from some of my male listeners. Why not a vasectomy? And women, I think that, it's fair to ask your partners, after all that your body's already been through, to get a vasectomy. So I would love, 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 love to hear what my male listeners specifically have to say about this. I happen to have the one and only Kylo Ren from The Force Awakens in the studio with me, and this is what he has to say.
Ladies, this is Kylo Ren. The Force is strong with you. Tell your husbands to get a vasectomy.
Okay, so I'm sorry. That was so dumb, but I'm super excited about the Star Wars mask that I got for Christmas. I've got Kylo Ren, I have a Stormtrooper mask, and I'm waiting to get a Darth Vader mask, but they were sold out. So ladies, when you go in for your 6-week postpartum visit and you're talking about contraceptive options, just remember, vasectomy for your husband should be one of those options on the table. I'm just saying. So I'd like to thank all of you for tuning in for this episode of the Ask Dr. Angela podcast. I am so excited about everything that this year has to offer, and we're going to have so much fun. If you have a question or a topic that you would like featured on the podcast, just go to www.askdrangela.com. That's drangela.com. Click on the microphone and do what you do. If we do happen to feature your question on the podcast, someone from my team will reach out to you and we will send you one of our bomb-ass t-shirts. And they are pretty bomb-ass. Folks have been posting pictures wearing them on social media, so you can check out my Facebook page, Ask Dr. Angela, or hit me up on Twitter, Dr. Angela OBGYN. You can direct message me, email me, however you want to do it. But anyway, keep those questions, keep those comments coming. I love hearing from all of you. And I've got to say that it's pretty amazing when I get an email just from somebody that I don't even know that happened upon the podcast and just gives you some great feedback and lets you know how much this is helping them. So thank you. In closing, I would like to leave you with this. The secret of happiness is to count your blessings while others are adding up their troubles. Remember, people, focus on the good. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 64.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.